One of the most surprising clinical findings about sciatica may challenge everything you've been told. Nearly 80% of adults over 60 with persistent lower back or leg pain are treating the wrong problem. Not because their doctors are careless, but because the real cause of nerve pain in aging spines is often misunderstood. Most people assume sciatica comes from a slipped disc, and while discs can play a role, recent clinical observations suggest something else is happening in many adults over 60. The real driver is often a gradual loss of spinal stability combined with reduced circulation to the nerves. And here's what most people over 60 don't realize. Your spine is not just bones and discs. It is a living support system of muscles, ligaments, blood vessels, and nerves. Over time, those systems change. Muscles weaken, inflammation increases, small stabilizing structures shrink. When that happens, pressure slowly builds around the sciatic nerve, the largest nerve in the body. And the pain you feel in your hip, leg, or lower back may actually be your body signaling something deeper. But here's where it becomes more serious. Most treatments focus only on reducing pain, not fixing the underlying mechanism causing the nerve irritation. And if that mechanism isn't addressed, the cycle continues. Pain, temporary relief, pain again. So today, we're going to walk through what spine specialists are now focusing on when helping adults over 60 reduce sciatica naturally and safely. Not quick fixes, but science-backed strategies that support the spine's structure, circulation, and recovery capacity. To understand sciatica, we first need to understand what happens inside the spine as we age. After the age of 50, several biological changes begin accelerating. One of the most important is muscle atrophy. The deep, stabilizing muscles around the spine, called the multifidus and transverse abdominis, begin to weaken if they're not actively used. These muscles act like internal support cables for your spine. When they weaken, the spine becomes slightly less stable, and this instability creates tiny shifts in spinal alignment. Those shifts may seem small, but for nearby nerves, even a millimeter of pressure can create symptoms. This is where the sciatic nerve becomes vulnerable. The sciatic nerve exits the lower spine and travels through the hips and down the legs. When surrounding tissues lose strength or become inflamed, the nerve can become compressed or irritated. This leads to classic sciatica symptoms: burning pain down the leg, tingling or numbness, sharp discomfort when standing or walking, weakness in the hip or leg. But here's something many people overlook. Reduced blood flow also plays a major role. As circulation slows with age, nerves receive less oxygen and nutrients, and nerves that are poorly nourished become more sensitive to pressure and inflammation. So the problem isn't always just compression. Sometimes it's compression combined with poor circulation, and that combination amplifies pain. But this is where most people go wrong. When back pain appears, the natural reaction is rest. Less movement, more sitting, avoiding activity. And while short-term rest can help during acute injury, long-term inactivity creates a different problem. It accelerates muscle weakening and joint stiffness. This reduces spinal support even further, and ironically, it can increase nerve pressure. Think of your spine like a suspension bridge. If the support cables weaken, the structure becomes unstable. That instability increases strain on the entire system. And for many adults over 60, extended sitting is one of the biggest hidden triggers of sciatic nerve irritation. Why? Because sitting places significant pressure on the lumbar discs and hip muscles. It also shortens the piriformis muscle, a small muscle deep in the hip that sits directly over the sciatic nerve. When this muscle tightens, it can compress the nerve from the outside. This condition is sometimes called piriformis syndrome, and it's surprisingly common in older adults. So the goal isn't complete rest. The goal is gentle, strategic movement that restores circulation and stability. But this is where most people go wrong. When back pain appears, the natural reaction is rest, less movement, more sitting, avoiding activity. And while short-term rest can help during acute injury, long-term inactivity creates a different problem. It accelerates muscle weakening and joint stiffness. This reduces spinal support even further. And ironically, it can increase nerve pressure. Think of your spine like a suspension bridge. If the support cables weaken, the structure becomes unstable. That instability increases strain on the entire system. And for many adults over 60, extended sitting is one of the biggest hidden triggers of sciatic nerve irritation. Why? Because sitting places significant pressure on the lumbar discs and hip muscles. It also shortens the piriformis muscle, a small muscle deep in the hip that sits directly over the sciatic nerve. When this muscle tightens, it can compress the nerve from the outside. This condition is sometimes called piriformis syndrome, and it's surprisingly common in older adults. So the goal isn't complete rest. The goal is gentle, strategic movement that restores circulation and stability. Here's what spine specialists are now focusing on for adults over 60. Not intense workouts, but controlled mobility exercises that restore spinal support. Let's look at 3 of the most effective. 1. Pelvic tilts. This simple movement activates deep spinal stabilizers. Lie on your back with knees bent. Gently tilt your pelvis upward, flattening your lower back into the floor. Hold for 5 seconds. Then release. Repeat 10 times. This helps reactivate the small muscles that support the spine. 2. Knee to chest stretch. This movement gently opens the lumbar spine. While lying on your back, bring one knee toward your chest. Hold for 15 to 20 seconds, then switch sides. This reduces pressure around the lower spinal joints. 3. Gentle walking. Walking remains one of the most powerful therapies for spinal health. It improves circulation to the discs and nerves. Even 10 to 15 minutes of walking per day can help maintain spinal mobility. But consistency matters more than intensity. The goal is not speed, it's circulation. But here's another factor that becomes increasingly important after age 60: chronic inflammation. Inflammation can make nerve tissue extremely sensitive. Even small pressure points become painful when inflammatory chemicals surround the nerve. And several lifestyle factors increase inflammation: highly processed foods, excess sugar, poor sleep, chronic stress, lack of movement. This changes everything after age 60. Because the body's recovery systems become slower, which means inflammation can linger longer than it did in earlier decades. Fortunately, small adjustments can make a meaningful difference. Spine specialists often recommend focusing on anti-inflammatory nutrition. Foods that support nerve health include fatty fish, rich in omega-3 fatty acids, leafy green vegetables, berries, nuts and seeds, olive oil. These foods support circulation and reduce inflammatory stress in tissues. And many adults notice gradual improvement when these habits become consistent. Now, while most cases of sciatica improve with conservative care, there are times when medical evaluation is essential. If you experience any of the following symptoms, a physician should evaluate the condition promptly: severe leg weakness, loss of bladder or bowel control, persistent numbness in the groin area, pain that worsens significantly at night. These symptoms can indicate more advanced nerve compression. In some cases, imaging, such as an MRI, may be necessary to understand what's happening inside the spine, and early evaluation often leads to better outcomes. Because many spinal conditions are far easier to manage in early stages. If you've been living with sciatica for months or even years, it's easy to feel discouraged. Many people begin to believe that pain is simply part of aging. But clinical experience tells a different story. The human body maintains an incredible ability to adapt and recover, even in later decades. What most people over 60 don't realize is that nerve tissue can heal when pressure is reduced and circulation improves. Muscles can regain strength. Joints can regain mobility. Inflamed tissues can calm down. But it requires addressing the root causes, not just the symptoms. Stability, circulation, inflammation, movement. When those systems improve, the spine becomes more resilient, and many people begin noticing something they haven't felt in a long time: confidence in their movement again. Confidence to walk farther, stand longer, sleep more comfortably, and reclaim daily activities that pain once limited. If you're over 60 and dealing with sciatica, remember this: pain is not simply a message of damage. Often, it's a message of imbalance, and when the body receives the right support, movement, nutrition, circulation, and stability, that balance can begin returning. Small steps, consistent habits, gradual improvement. And if you value clear, evidence-based insights about protecting your spine, brain, and vitality after 60, consider subscribing, because the most powerful health knowledge is not the loudest advice. It's the information that quietly helps you take control of your health again.